My name is David Schuster. I am the Division Director of Nuclear Medicine and Molecular Imaging at Emory University in Atlanta, where I am a professor. Now let's go on and discuss the Lugano staging system, and it's also often used the Lugano response criteria. So if we think of Deauville as a component, then Lugano is the home matrix. And I mentioned Lugano before, it's a place, and this is kind of where all these standardized criteria grew out of, all these conferences that the experts were going to and discussing the problems that we had in diagnosing and staging and treating lymphoma. So Lugano staging and response criteria grew out of this work and incorporates that Deauville imaging visual assessment for PET for metabolic response, but it also has a anatomic component using CT, though I guess you could also use MR. And it has a place where you don't have to use both, but you could use either or depending on the equipment. Now, for many lymphomas, PET is the preferred, but there may be places where PET is not easily available. And so we have also anatomic criteria. So an example of this is from again, the NCCN guidelines for non-Hodgkin's lymphoma. And this is divided into, for example, complete response. And on PET, we talk about, getting to from Deauville 4 or 5 to Deauville 1, 2, or 3. Okay, so that's kind of a simple part. But then if we look at CT side, then you have target nodes or nodal masses. And there's certain criteria for those two. In this case, they must, get smaller to less than or equal to about 1.5 centimeters in largest diameter. And not to get into all the very specifics, but the idea is that we have both a metabolic or a radiologic response. So partial response, for example, using that Deauville criteria for lymph nodes and extra lymph node sites. Let's say you have score of 4 or 5 without any new lesions, but it's decreased from before. With CT, we can measure the product of the diameter. So you sum 6 target lesions in this case, and you multiply each lesion by its perpendicular diameter, and you add them all up. And then you want to see, for example, with partial response, if there is at least a 50% decrease in of these, some partial diameters. And then there's a lot of very complicated rules, which one really should just refer to the table. I think an experienced imager oncologist knows these by heart eventually, but this is useful, especially when you're first learning, to have this table up. And then we have, similar for bone marrow. And then there's a category called no response or stable disease. And that has its own criteria. And then there's progressive disease. And for example, on the PET side, if your score of 4 or 5 has gotten worse, or if you have new lesions, that's considered progressive disease. And there's also a whole host, you might say a menu, that you could pick from on the anatomic side, looking for progressive disease as well.